Hello, doula clients. I get asked a lot about induction. It seems every year more and more and more inductions, our rates get higher and higher. So I'm just going to make a little video for you to watch so you can learn what's involved, what the methods are. So basically, induction is a two-step process. The first step is to get the cervix what we call ripe. That means the cervix is soft, it's starting to dilate. If anyone's interested in the geeky stuff, you can look up Bishop's score. That's kind of what decides what stage you're at, stage 1 or stage 2. So the first stage, we take the cervix that isn't ripe yet. Maybe it's closed and tight, as we expect cervixes to be before labor starts. And so that's the first step, would be getting the cervix to the point where it's ripe. The second step, once the cervix is ripe, now some people after the first step, they'll just continue on into labor. If not, if labor doesn't keep going, then we go to the next step. I'm going to explain what all this is, by the way. Or if you get a cervical check and find out your cervix is already ripe, some women walk around at like 3, 4, 5, even 6 centimeters for days before they're in labor, or even a couple of weeks. So if that person got checked and was choosing induction, then they would go straight into step 2. This will make more sense as we go along. Okay, so I'm going to, I got little visuals for you. Okay, so induction of labor, we basically have 5 medical ways. Some of you know, I also talk about castor oil and acupuncture and things like that. I'm going to keep that a separate bit of info. So anyway, induction of labor, these are the ways. These first 3 are to help the cervix get ripe. Okay. So if the cervix needs to be ripened, you're starting off with a closed cervix, they can put it's actually a catheter. It's the same one you would use for emptying the bladder, and that goes into the cervix. It gets blown up, and then they do just a little bit of monitoring and then send you back home. And hopefully this will be enough to kind of get things going. It can start contractions, but the main purpose of this is to get the cervix starting to dilate, get the cervix ripe. There's no medication or anything like that. This just goes in. Now, this can only be done in a cervix if the waters are intact and if you're not yet ripe. Okay, side effects are very few with this because there is no medication. So you get it in. Some people find it uncomfortable. Had a couple clients say don't wear shorts because they left there with this little thing hanging out. So that's not an issue in our winters here, but anyway, I just thought I'd pass that on. They were sending me pictures of this thing hanging out while they're wearing their shorts. It was kind of funny. Anyway, trying to find some fun in this whole induction thing. So yeah, that you just go home and wait. If it falls out, that means your cervix is starting to ripen, and that's good news, right? Okay, so the next thing we have is Cervidil. So that's like a little applicator, almost looks like a little strap or piece of tape. It's not a piece of tape, but it just goes up here, and it sits against the cervix, and it delivers a medication called Cervidil. And that's in the class of prostaglandins, if anybody likes to know that kind of thing. And that is meant to get little contractions started to soften the cervix. And same thing as before, you get that put in by a doctor in the birth unit, and then you get sent home, monitor baby for a while, and then you get sent home. And depending on many factors, you'll be asked to go in again in 12 to 24 hours if you're not already in a productive labor. This is where you might hear people say, I was induced for 36 hours. And that's because they might have had repeated doses of Cervidil. So benefits to this, it's relatively not invasive and you get to go home and wait. And the Cervidil is nice because if there's hyperstimulation, whenever we use this class of drugs called prostaglandins on the cervix, there can be too many contractions. That's a side effect. And then if that happens, they just pull the Cervidil out. You just go back, get it pulled out. So pretty easy that way. Now it sounds benign, right? Oh, we just put this little thing against you and then it'll start some contractions and get the cervix to like 3-4 centimeters. And that's how it can be. Some people will go into labor with this. Other people have a really difficult early labor going on with this to the point where they're going to go in and get morphine and Gravol, maybe some fentanyl, like some kind of a pain medication, but they're not yet in active labor. So then they'll get sent home, hopefully to sleep. So pain medication is a whole other topic. I have this little cool thing, if I do say so myself, that I designed. So I'm just going to take you through the first two things here that I talked about. So the oh, there we go. These purple cards are kind of the default of an uninterrupted birth, okay? And yellow is going to show interruptions or what happens with interventions. And that doesn't mean purple's good, yellow's bad, not at all. There are always reasons for everything, right? Every intervention has its place. I mean, consent and do you really need induction? And that is a whole other conversation for, and those are things we talk about together in person or on the phone. Anyway, so if you get Cervidil or the balloon catheter, okay, you still possibly have your choice of birthplace. And I mean, often if you're getting induced, you have been transferred from midwifery to obstetrical care. So you may or may not have your choice of baby catcher. We're losing labor starting on its own, but you can still do early labor at home. You can walk and move about in labor. Pretty much all these other things stay the way they are. That's the best case scenario. Oh, there's my dog here to say hello. This video is just for my clients. I have a bit of a birth hangover here, so we're on like not fancy mode here. Anyway, so you can still, like, the idea, the wish is that you'll just go into labor and all this other stuff stays the same, okay? There is no increased risk of caesarean with these early methods of getting labor going. So get a balloon, get catheter, go home, wait for labor to start. Best case scenario, labor will start. You show up later on at the hospital in active labor. I don't know if you could stay home and have a home birth with a midwife. You would have to double check that with your midwife with these, okay? And then everything else can go according to whatever your plans are. So that's best case scenario. In reality, what happens more often is that maybe things will get going to a point with this. Hopefully the cervix gets ripe. And then the next step would be to use oxytocin or something to keep labor going, okay? So oftentimes one thing leads to another. Now, there is kind of an in-between here I'm going to talk about as well. There's, so that's my dog. There is a medication called Cytotec, Misoprostol, that we've just started using in our area for induction. And that's pills actually that you swallow. And there's been a lot of problems with this medication in the States. And I've been told, well, we're using it differently here. It's still fairly new. So we'll see what happens with this. Now, this is also prostaglandin. So this is meant as a first step induction method. And this can be used when your waters have released. That's why they started using this here, because you can't use balloon and Cervidil if the waters have released. And so then people's choices were, well, let's do the next step and hope it works. But it is, everything works better if we can get that cervix to that ripe state. Okay, so the Cytotec is different though, in that you would go in, get Cytotec tablets, and then you'd stay in the hospital, because this does have a like a big side effect of hyperstimulation. And they do low doses. They're hoping this doesn't happen, but if it does, you need to be in the hospital, you need to be monitored, and they need to use medication to turn off the effects of this if you do get that hyperstimulation. So if you know, like if your waters have been released, and maybe that's why you're choosing induction, because of the waters being released, or maybe that's just a timing thing. But if induction is recommended with released waters, it'll be Cytotec. So take your stuff with you to the hospital. I mean, that's always kind of a good idea with induction anyway, but you won't be going home with this medication. And this medication can be used through labor. So I'm not sure yet, once, because I've seen it go both ways. Once this starts, this will probably be the medication you keep using through labor, but I don't know. It might, like, if you don't need extra, you're not going to get more. Like, they're not going to keep getting you to swallow these. If your labor, same thing with those other two methods, if your labor gets going, excellent. So I'm going to share the I know this is new. I'm still learning about it. And so I might replace this part of the video like in a year from now, when I've seen more people use this. So anyway, with the Cytotec, you don't have a choice of birthplace anymore. And probably you would get whoever the obstetrician, maybe family doctor. I'm not sure. You'd have to talk to care provider about this. You're not doing early labor at home, and you are being monitored. Where's my monitoring? So now you have continuous monitoring, because it is a pretty significant drug. You can take some breaks from the monitor. Monitoring is also a whole other topic, but it definitely goes with using the Cytotec. But you can still walk and move around. They will tell you not to eat. You know, there's a waiver though. Your labor is not progressing naturally. You might be able to labor in the bath or shower if you ask for the wireless monitor. Okay, so that's a maybe card with this. And people are more likely to choose pain meds if they're using the Cytotec, but not necessarily. It really depends on how you respond to it. So it does change things for you. Yeah, but it can also work. All these things, like, kind of wrestle with telling you all the things that can happen, because we also know what can happen is you just get a little nudge and then go into labor and things keep going on their own. Okay, so this has all been stage one, the first step in getting the induction going. The Cytotec, yeah, if your waters are released and you are already at 4 centimeters, then you're considered to have a ripe cervix. So anyone with a ripe cervix would go into step 2, which I'm going to talk about now. The other people who go into step 2, like say the Cytotec or the balloon or the Cervidil doesn't work. There's a reason that labor has to get going, and none of these other methods have worked to ripen the cervix. Or if someone has an actual medical reason for being induced, such as they have blood pressure issues or preeclampsia or something like that, and we have like a short timeline, it's like, we need to do something to get this baby out, and it has to happen pretty quick, then in that case, people might be given go straight to step 2, even if their cervix is closed. Now, the reason for wanting to have a ripe cervix before we do oxytocin, which is the step 2, is because if we do that step on a closed cervix, the risk of cesarean doubles. And that's why with induction, your doctor that you're consulting with will recommend, okay, let's get you to the point of having a ripe cervix, a soft cervix. And that way, when they use the oxytocin induction, it's likely to not increase the risk of cesarean too much. It can have other things. I'll go through that, but when you hear double the risk of cesarean, that's when someone goes right into the oxytocin induction without having a ripe cervix. So there are 3 medications that can be used for that step 2. Syntocinon is also called Synto. These are words you might hear. That's why I'm telling you this. Oxytocin or Pitocin or PIT. So these are all words you may hear. PIT, Pitocin, Oxytocin, Synto, Syntocinon. You might be told oxytocin is the same thing as what our body makes, because our body does make oxytocin. That's one of the main driving hormones of labor. However, it doesn't work exactly the same in the body. When we go into labor, our brain releases oxytocin. It goes through our body, causes the uterus to squeeze, and it comes out in little squirts. When we use oxytocin in an IV, it does not go through our whole body. I mean, it does because it's in an IV, but it doesn't cross that blood-brain barrier. It's kind of like it just goes and makes the uterus squeeze without all the whole body going into labor with all those endorphins and everything. So that's why if you've had acupuncture or if you can do some of those other things to create that kind of labor vibe, that'll help, okay? So anyway, I'm just going to go through what does it look like if you get an oxytocin induction. By the way, if you're already in labor, this medication can be used to pick things up, and that's called an augment. Same, everything's the same. What I'm going to show you, augment if you're already in labor, and induction if you're not. So let's say either you are far enough along to do the second stage, or I guess that's exactly what, let's be optimistic. That's where we're at. So definitely you would be in the OB pool with this medication. And you have continuous monitoring for sure. There are straps that go around the abdomen, and there is a lot of fiddling with this, okay? You'll have an IV. You can wear your own clothing. You might be told not to, but you still can. People are much more likely to use pain medications with an induction, but not everybody does. I've seen a few people who didn't. But it would be wise to prepare for, like, check out the information about the gas and the epidural, okay? If you get, now here's where things kind of compound, right? If you get the epidural, then we're not walking around in labor, probably confined to bed. You're not going to be getting up to use the bath or shower anymore. And unless you buy a special little labor dress, you're not going to be wearing regular clothing anymore. You might be able to, but most people don't. You probably will be told not to use the toilet. So now here's the next thing in this cascade of intervention. Probably get a catheter. And if you have an epidural, you may or may not feel that urge to push. We know with epidural use, we are more likely to have vacuum or forceps. And when we have vacuum or forceps, we are more likely to get an episiotomy. Okay. And we know that when all this is going on, there is an increased risk of cesarean. So, and then that leads to a more difficult recovery. Definitely choice of birth position is gone. There is some separation of the baby and the parents just right away. And if you're in the OR, you can do 1 minute of cord clamping. That's all. So this can really change things. Now, being optimistic, if you have an oxytocin induction, I mean, optimistic, of course, is no induction at all. But if you have an oxytocin induction and don't choose pain medication, then you could still move around. The monitors are annoying, but you know, that's just what it is. You would be able to get in the bath or shower if you use the wireless monitor. Recovery could be the same. You could still wear whatever you want. So I'm turning off these things that go with the pain meds. Anyone can get vacuum force, so any of this stuff, of course, at any time. It has its place, but you know, this would be the best case scenario with an oxytocin induction. So these are decisions to not, don't take this lightly. If an induction's based just on dates, is that worth it? Maybe it is, maybe it isn't. Always ask your questions. We talk a lot about consent, and I help you ask questions, of course, but I just wanted to show you sort of what you're getting into and what your choices are with induction. You won't probably be asked, oh, what kind of induction do you want? I mean, you might, if they have to ripen, I would say ask questions like, why are they choosing one method over another? Of course. But if your cervix is not ripe and you're generally healthy and baby's generally healthy, then it's going to be one of these methods to ripen the cervix. If your waters have not released, balloon or Cervidil. If your waters have released, then the only option really is the Cytotec. And then nobody would say, oh, would you like Cytotec or Oxytocin, like that, because they're going to look at the clinical picture and make a recommendation for you. Okay. With the Cytotec, you don't need to get an IV. So for some people, they like that better, but you still have all the monitoring going on anyway. So that's kind of the lowdown on medical induction. The other thing is releasing the waters with an amnio hook. I'll just show that to you here. It's coming, I promise. It's in another section of my notes here. There it is. Okay, I have a little, so releasing the water to start labor. Okay, that is something that typically doesn't work in first timers, and like if you're having your first baby. And I don't see this being recommended very often, if ever, for someone who's never given birth before. When you're already in labor, it might be recommended to help speed things up. If you're past, like, you know, past 6 or 8 centimeters or something, then certainly that can happen. If you've given birth before, then sometimes it's usually not the first thing they recommend, having the waters released, but it might go with, like, if you have an induction and you're getting more and more medication, you're hooked up to the IV, you know, nothing's really happening. I've seen that before where, and it's not your first baby, then someone will recommend, well, let's break the water and see if that thing gets things going. And it can work really well for that. And this is what the amnio hook looks like here. You know, I'll play this little video for you. I'll actually fix the sound though, so you can hear it. Just because you're here to learn about induction. So let's give you all the info.
Hey, this is Sarah with Birth Boot Camp. Probably looks like I'm getting ready to crochet a baby blanket, but no, today we are going to talk about an amnio hook and answer the question, what is an amnio hook? And this is it. It's about maybe a foot long, and if you look closely, I'll show you, you can see a little hook on there, and that is what is used to break water or the amniotic sac. And that's what the amni hook is used for, is to break your water in labor, or sometimes it's used to start labor. And your care provider, if they use these, they will just place it up inside the vagina until they find the bag of water, and then they poke a little hole in it and your water breaks.
So that's how that works. It is unlikely that that will be recommended as your method of induction, but just for completeness, of course, everything comes down to asking questions. Why are we doing this? Is it necessary? What are the other choices? I always recommend people do acupuncture first, and my directory for my clients has a nice list of people who do like labor induction. It does usually take more than one appointment, so don't wait till the night before. And then there's the castor oil cocktail for people who have given birth before. It doesn't work very well in first timers. It does work better if the cervix has started to change a little, which is often the case in people who've given birth before. And by the way, it's not meant to just put you into a big diarrhea fest, because I have a cocktail. It's actually a blend. Do not just drink, like, don't just drink. Maybe I said I wasn't going to talk about this, but hey, let's talk about it. It's the induction video. The cocktail I have is not the same thing as just chugging. Okay, you don't just chug the castor oil. Please don't do that. It will be a diarrhea fest. It's terrible. It's a little bit, it's blended with some nut butter and some juice to kind of slow the absorption. And also there's an herb in there called lemon verbena, just a tiny little bit. And what that's in there for is it helps to calm the digestive system from the castor oil. So those things go together. That is like an ancient midwives blend that's been used through the ages to more gently get things going. We use that a lot in Alberta when I was working with the midwives there, and we would recommend 1 or 2 doses. And if it doesn't work by the second dose, probably not going to work. Anyway, I saw lots of people use that without having a horrible diarrhea filled labor. It is still induction, but it might get things going to the point where you just go to the hospital and have your baby, or you would tell your midwife if you're taking it. We had lots of people there who did home birth after having a castor oil. I mean, not lots. I don't want to make it sound like, oh, everybody used castor oil. It is still induction. It is still a decision to make, but we used it often enough. And then people just went on to have a normal labor. And for some people, it didn't work at all, especially if they've never had a baby before. I just don't recommend you even try with the first baby, just because it just doesn't work very well for that. I mean, it never hurts to try, but anyway, so that's the lowdown on induction, and this is just for my clients, so please keep this video to yourself. This isn't one I necessarily put out there for everybody else to see. Yeah, so I don't know why, probably because I have a birth hangover and I'm just feeling a little bit disheveled, but don't worry, I did sleep. My brain is working. The info is accurate here. So anyway, okay, now I'm just doing this. So I'm gonna say bye. Okay.